My name is Alison King, and I'm the Behavioral Health Clinical Program Manager for Managed Health Network, MHN, which is the Behavioral Health Administrator for HealthNet members. So, millions experience symptoms of mental health conditions each year. And, since the pandemic, the number of people struggling just continues to grow. I'm sure people are aware of this. And, having a mental health condition is really similar to having a physical health condition in that early identification and intervention is key. But, if we begin to shift our lens from this kind of intervention to a more of a prevention focus, normal experiences of the human condition can be managed before becoming actual diagnosable clinical mental health conditions. Not all of them, obviously, but there are several which fall into that category. Today, I'm going to be presenting on the most common mental health challenges, which are directly related to the human condition, and offer a suggested pathway to fortify ourselves and build resilience, as well as knowing when and how to recognize if we might need to seek some additional outside professional help. Okay, so just a little bit of context first. I started giving presentations on behavioral health related topics during the pandemic. And because of its ongoing impact, especially when it comes to mental health, I think it's really important to continue to see it or view it as a through line or as a backdrop as our lives become more normalized again. That being said, I want to talk a little bit about some positive things born from the pandemic. For one, it's really helped us realize what matters most in life. Now, there's probably some individual variation with this, but there are definitely some common themes, like the importance of family and friends, of having a healthy work-life balance, of caring for our health, of caring for our communities. The pandemic has also helped us become more comfortable with the fact that we all struggle at times and that it's okay to not be okay. So this slogan has become a little bit kind of cliche in the past couple of years, but what this tells me is that as a society, we've become more open and honest and more comfortable with our human vulnerability. As an example, when someone asks you, just could be anybody, right, randomly, how are you? It's actually okay now to answer more honestly and not just do the socially acceptable thing, and you can actually share how you're doing, how you're actually feeling, which for me gives me a lot of hope in us as a human race and humanity. So it really seems like the age of COVID has helped begin to destigmatize mental health because so many people are struggling. So what are most people struggling with? So the top two mental health conditions shouldn't be a surprise to anybody. These are always the top two, even well before COVID. It's just that more people are suffering and seeking help than ever before. First, I wanted to show this recent data from the 2023 U.S. Census Bureau Household Pulse Survey. Data is constantly coming out, so I keep trying to find what's the most recent. So this is the most recent that I could find. So this is based on adults, as you can see, and I'll talk about use later on a little bit in the presentation. There'll be a bit of a focus on that. So this data on the left here is the share of adults reporting symptoms of anxiety and or depressive disorder. So these are symptoms, okay? So these aren't diagnoses per se. So as you can see, 33.3% of all adults in the survey, and unfortunately, I'm sorry, I didn't note here how many people participated, what the N number was here, reported having symptoms. And then there's the age breakdown. The highest is 18 to 24, which is just under 50%, 25 to 49, which is 38%, 50 to 64 is just over 29%, and then 65 and older is a little bit over 20%. So, I wanted to show this Venn diagram as well, because it's important to know that depression and anxiety frequently overlap, thus the and/or in the data on the left. In fact, recent studies have shown that 80% of people who suffer from anxiety also suffer from depression and vice versa. And someone recently even asked me not that long ago, really, what is the difference between the two? Which is a very honest, open, question. And that really shows how connected they are, right, in people's experience of them, because there's a lot of symptoms that kind of overlap, as you can see by the center of that Venn diagram. So to put the survey on the left in context with the pandemic, some other recent studies have shown that depression and anxiety has increased about 28%. That depression has increased about 28% and anxiety by about 25%. And I'm sure when the next set of data comes out, it's going to be even higher. Now, in the spirit of mental health destigmatization, I'd like to frame both depression and anxiety as being part of the biggest condition of all, which is, as I mentioned before, the human condition. So what do I mean by this? So depressive feelings can be a normal reaction to bad, sad things that happen in life, because they happen all the time and everyone experiences them. And the same goes for anxiety. As a quick pandemic example, I don't think I'd be out of line in saying that all of us were anxious to a certain extent at the beginning of the pandemic, and maybe even throughout the pandemic. The question is how severely and persistently we're experiencing symptoms, and are they impacting our functioning, our daily lives? These are the things really to look at to know if we are going to need more help, which I'll get to later on in the presentation. Okay, so speaking of needing help, here's a little breakdown of some of the diagnoses which fall under the categories of depression and anxiety. I wanted to orient you a bit because we hear some of these terms thrown around, and I thought putting them into their actual diagnostic clinical context might be helpful for people. And this list is not comprehensive, it's just the most common types. So depression. So the main categories are major depressive disorder, otherwise known as major depression, which is basically, just think back about, we'll talk about the symptoms in a bit. I'll break them down in a bit, but you can also just think about that Venn diagram for the moment. So it's any of those symptoms, but for several weeks at a time, and having a significant impact on our functioning. And major depression, really it's kind of cyclical. So meaning you go through periods of significant challenges with those symptoms, and then going back to periods of normal, or more of a baseline, so kind of cycles. Dysthymia, or persistent depressive disorder, are basically those same kind of symptoms, but lower level, less intense, and enduring and persistent, meaning that they don't really abate. And oftentimes when people suffer from persistent depressive disorder, they almost feel like it's just kind of who they are. It's their personality, because it's been going on for so long and so ingrained into how they experience the world and how they interact and how they feel and their mood. So it becomes it feels like it's part of their personality because it's enduring. So anxiety, we have specific phobia. So those are things like, being afraid of needles or spiders or dogs. So it's really related to something very specific. Then we have social anxiety disorder, which, to be honest, I sort of verged on that myself when we came out of the lockdown of the pandemic. How do you interact with other people, right? Whether it's a one-on-one situation, could be meeting somebody new, it could just be in any kind of social situation at all. Then we have panic disorder, which is really when the symptoms of anxiety move into really significant, more physical symptoms like heart beating fast, hyperventilating, feeling like you're having a heart attack, sweating, passing out. Like it's really the physiological aspect really takes over, the anxiety experience. And panic disorder can go hand in hand with any of the anxiety types listed here. Then we have agoraphobia, which is basically, the fear of leaving your home or being in open spaces. And really, people who have agoraphobia, it can be very severe where they can't leave their homes at all. And then there's generalized anxiety disorder, which is basically being anxious about everything all the time. And in fact, when there isn't something to be anxious about, a person with GAD tends to, their mind starts to look for something, like almost searching for something to grab onto, to be anxious about. That's how automatic it becomes. And someone recently described GAD to me as feeling like their blood, it's this constant low vibration going on all the time and flowing through their blood, so they even feel it like this river in their system. Even if something specific isn't happening, it's just always there. Then I just have down here some other conditions of note which fall into these diagnostic categories, like obsessive compulsive disorder, OCD, and related disorder. And the related is things like body dysmorphic disorder, which can relate, has a direct connection to eating disorders. Skin picking, hair pulling, hoarding, those are all in that category of related disorders to OCD. Trauma and stressor-related disorders, so things such as adjustment disorder, which is adjusting to something significant that has happened. Often it's been some sort of trauma or crisis, but really the symptoms are a little bit less intense, and it abates after a while. So it's really looked at by the amount of time that you experience it. Or acute stress would be next in line after adjustments in terms of the length of time and intensity. And then PTSD, post-traumatic stress disorder, which I'm sure a lot of you have heard about. Again, connected to the how long someone's experiencing symptoms and how pervasive and how significantly they are impacting them. And then at the bottom, we have substance-related and addictive disorders, which is also really rising actually in the numbers since COVID. So things like alcohol or marijuana, opioids, these are all examples of some of the things that we're seeing a lot more of now. Okay, all right, so let's dig into these just a little bit. Anxiety. As you saw from the last slide, anxiety is really a very big category. But, I've listed some symptoms here, which are pretty common to all of the types of anxiety. So these run across all of them. So being nervous, restless, or tense, feeling keyed up, people describe it as not being able to get anxious thoughts or beliefs, thoughts or beliefs out of their head, and they're very difficult to control. Difficulty focusing or concentrating. And then there's this panicky type symptoms, which are physiological, like heart rate increasing, sweating, tense muscles, hyperventilating. Aches and pains, again, related to the mind-body connection, as well as to other chronic health conditions, which I'll talk about in a little bit. Being fatigued, irritable, or having a lot of difficulty falling or staying asleep. Now, who's at greatest risk? So women, children, teens, and young adults, people with history of trauma or stressful life events, having chronic or serious illness, which I'll talk about in a little while, and then substance use, which we call comorbid, actually, so going on at the same time. So substance challenges at the same time as having an anxiety or depressive disorder. With that history of trauma and stressful life events, I would say that a lot of us, even if we don't fall into any of those other categories here of who's at greatest risk, all of us just went through something collectively very, very stressful. So I think it's important not to overlook the impact. So the lifetime prevalence of anxiety disorders is 26% for men and 40% for women. And if you add on things like intersectionality, like meaning if you're a minority or have have lower socioeconomic status, or if you have a sexual orientation or gender identity which is outside of what's considered the norm, your risk is going to go up, right? People's risks go up. And this will be the same when we think about when we talk about depression next. And I put this image here from Doris. I don't know if you know who the photographer Dorothy Lang is, who took all those pictures of the Dust Bowl during the Great Depression. I just think this is such an amazing photo, and it's such a true to life, right, experience of what anxiety can feel like. Okay, so depression. What are some of the symptoms of that? Feeling hopeless or pessimistic, having a persistent sad or empty mood, being irritable, easily frustrated or restless, feeling guilty, worthless, or helpless, losing interest in things that we used to give us pleasure, being tired, having a lot of, feeling slowed down, not a lot of energy, trouble concentrating, remembering, or making decisions, trouble sleeping, early morning waking, or sleeping too much, changes in appetite or weight, if that's not your focus, right? If you're not trying to lose weight, or if you're not trying to diet, or if you start, gaining weight, and that's not what your goal is. Having aches or pains, headaches, or digestive problems without clear physical cause, again, that mind-body connection. And then some suicidality, thoughts of death, or engaging in self-harm, or suicide attempts. Okay, so who's at greatest risk here? Topping the list, teens and young adults. So according to the CDC, in the 10 years leading up to the pandemic, persistent sadness, hopelessness, and suicidal thoughts and behaviors have increased about 40% among young people. Now, there's so many factors that can be named as related to this, the digital lives of youth and the impact of social media, socio-political climate, rampant gun violence, global warming, environmental issues, the list goes on. And now, layering on that, the pandemic and all the impact of that, that period of social and academic disruption, maybe having loved ones who've died, parental job loss, increased rates of physical and emotional abuse. And then again, another layer is, the normal ups and downs of childhood and adolescence, right? So clearly they're struggling. I want to give one more bit of data that I just came across a couple of weeks ago that I added into this presentation. It's another report by the CDC that was published just in February that really calls out the alarm, not only for youth in general, but especially for girls. In a national survey of over 17,000 students in grades 9 through 12, 57% of teen girls felt persistently sad or hopeless, which is double the number for boys and represents nearly a 60% increase from the last decade. About 30% seriously considered attempting suicide, also up about 60% from the last decade. And here's an additional statistic, specifically about LGBTQIA+ youth. More than half, about 52%, had recently experienced poor mental health, and even more concerning, more than 22% had recently attempted suicide in the past year. So I need to take a breath right here, because I have to say, in all honesty, every time I read these statistics, I find it to be very sad and very overwhelming. Especially because, in all honesty, I have a child who falls into these statistics. So it's pretty concerning, right? It is very alarming. That's the reason why I like to do these presentations, because I like to raise awareness of what's going on out there. All right, so I'm going to go ahead and finish these statistics. So, or this list rather. So older adults, of course, are at high risk because as we age, loss becomes central in our lives, loss of loved ones, friends, family, loss of physical and possibly cognitive capabilities, which leaves us feeling really isolated and alone, and then that increases our risk of depression. Next are people who are marginalized. Discrimination increases the risk of depression, but it goes beyond things like race, class, sexual orientation, or gender identity. It basically affects anyone subject to exclusion, including people who don't meet beauty standards, like or people who have disabilities. Then we have people who have lower socioeconomics, lower education level, and then those folks who are single, childless, and living alone. So this is where I actually, I'd like to take a collective breath, if that's okay. You can, I'm going to take one. You guys are free to take it with me if you'd like. It's just going to take a moment before I finish up all of these kind of difficult slides. So let's just let all of our air out of our lungs, emptying our lungs. And then breathing in, preferably through your nose, all the way up, expanding our lungs in all directions, front, back, sides of our ribs. Let's hold it for a few moments. Now let it go. So there was a dual purpose to that. One was for me, and the other was for you all, and just to model how important it is for us to take time, to breathe regularly. Okay, so now that I've presented all that gloom and doom, I have one last brief educational slide about the mind-body connection. So a full discussion of this topic is really outside of the scope of this presentation, but I wanted to show you the top physical health conditions, which are known to be deeply connected to mental health. So this is, a lot of research is done about this. There's a lot of evidence to find the connections with these particular conditions. So as you can see, the list is long. I'm just going to highlight a couple of them on here, like Alzheimer's, diabetes, hypertension, musculoskeletal disorders, Parkinson's. So you can see this is a very long list. So really, mental health and physical health go hand in hand. Because of the nature of chronic illness, whether it's because of pain people are experiencing, the number of hospitalizations or medical interventions, hormonal changes that might be happening, fear, everything, right? Having a chronic disease puts people at risk of developing a mental health condition. And as I mentioned before, a lot of mental health conditions can trigger or have part of the symptomatology are physical in nature, what we call psychosomatic or psychologically related aspects of the condition, manifestations of conditions. So just another couple of statistics here. Major depressive disorder is prevalent in 51% of Parkinson's patients, 42% of cancer patients, and 27% of diabetes patients. So that can just give you a sense of how intertwined they are. Okay, that was a lot. Maybe we should have taken the breath here, but I needed it earlier. So, that point was necessary for me. So that was a lot. So, the question is, how can we help ourselves from going from not okay, like we talked about in the beginning, to bad? How do we keep ourselves from going over the edge? How do we protect ourselves from going from depressive feelings or having anxious feelings, or a short-lived experience of anxiety, again, part of the human condition, to either of them becoming an actual clinical condition? The way we do that is preventatively, is through self-care. So what is self-care? Self-care really, it's really conscious, deliberate activities we engage in to take care of ourselves. And why do we need it? It's really the key to mental and physical wellness, to helping us build resilience and to creating a balanced life, a healthy, balanced life. It's required to reduce our stress and anxiety and depression if we have that, struggling with it, or if we have symptoms of it in any way. And it's also needed to, protect us from burnout or compassion fatigue, especially if any of us are in the helping professions. And I'm going to go on a limb here and say being a parent of young children is a helping profession in some regards. So it's definitely needed. And I'm going to talk about the timing, how that works as well, because it's so hard, especially if you have young kids. And it's needed daily. That's the challenge. How do we do this daily? So most of us probably don't realize that engaging in self-care is really the same thing as building resilience. It's preventative. So self-care is preventative medicine, really. Now, although the concept of self-care is theoretically very simple, I engage in self-care, but it's something we often overlook until we completely are just flat out depleted. And it's, we really, really need it. So I want to break down self-care by using this model to frame it, which can help us kind of figure out where we might need to pay attention more in our lives to build this kind of balanced life and build a resilient self. So whole person self-care. Now there's a lot of different models out there if you look up self-care on the internet. There's lots of different ones. I like this one because it's really simple. So whole person self-care. So biological, psychological, social, and spiritual. And I'm going to break it down on the next slide. But really the idea is to develop practices to attend to each one of these domains as equally as possible. I have just a couple of things to say about spiritual before we move on to the next one. Obviously, full true discussion of this is outside of the scope of this presentation, but I just wanted to note that religion and spirituality are not necessarily one and the same, because some of us might not have a religious practice. We might be completely tied to science, but that doesn't mean we can't or don't have a spiritual practice. They aren't necessarily one and the same. If you have a spiritual practice, it's important to really attend to that part of ourselves. Sometimes we let that fall off. Spirituality really helps bring a sense of perspective, meaning, and purpose to our lives. And if you don't have a spiritual practice or religious practice, which can go hand in hand, it may be a good time to think about it, right? What does spirituality mean to you? Because big existential questions like, what is my purpose in life? Why is this happening? Why is this happening to me? Why is this happening in the world? They really come up in times of crisis. And we all, as I said before, we all just recently collectively went through a big crisis. All right, so we're gonna dive into some of these domains just a little bit on the next slide, and how to figure out how to engage in self-care on a more regular basis. All right, so first and foremost, we have to have a daily life routine. It's completely our foundation. Having a daily rhythm grounds us and helps create a sense of normalcy and build self-care. And self-care really needs to be built into that routine. And Chris and I were just talking about this as we were chit-chatting. We were like, oh, building in the physical, physical exercise. Sometimes that can be hard. And, she talked about getting up at 4:30 in the morning, which is so early. I get up at 5:45 myself. So, but I mean, that's kind of what I have to do, depending on your life. So I'm not saying that you have to do that, but I guess what I'm saying is that finding a way that works for you to build in these kind of things in daily, whatever it's going to look like, is important. But before I go any further, actually, I just, I gave this presentation a lot. This part of this presentation, this is part of another presentation I give. But this part, when I would get to this part of it, someone said to me one time in 2020, they said, oh my gosh, I like just looking at the slides, they were like, oh my gosh, this seems like a lot. What if all you can do is nothing, right? Completely unable to do anything, paralyzed, right? So I just want to normalize that, because we all feel like that sometimes, and we need to listen to ourselves when that happens. And sometimes doing nothing is self-care. And that being said, laying on the couch and binging on Netflix may be exactly what we need at certain times. And actually, it happens to hit both the biological and biological and psychological domains of self-care. And if you add in watching with a friend or family member, you're tapping into the social domain as well. But remember, this is about balance. And if we find ourselves unable to activate it all, and we can't get off the couch, right? That's when we know something is wrong. And I'll talk about that in a little bit. So let's look at a couple of these. Well, actually, let's look at all of them. So the self-care domain of biological. So there's classic concepts or activities, which you've probably heard, like getting regular medical care and healthy diet, exercise, getting enough sleep or rest. So how do you so the idea of self-care here that I'm selling or trying to sell is reframing these into daily doable practices so it feels manageable. So taking multivitamins, grabbing an apple or something healthy today rather than a donut, just for today. Each day we have a new opportunity, right? Setting a timer and doing push-ups or jumping jacks during the workday. Or I just put that in there because I think it's funny because I do know somebody who does some calisthenics during the day, at normal intervals. That's how they get in their little routines. Or, taking a walk, right, in the middle of the day, at lunchtime. Turning off the phone, not engaging in social media, no screens, 30 minutes to an hour before bed. So these are all things that we can actively work on and build into our daily lives. Okay, psychological, mindful meditation. So I'm going to stop here. You see that little asterisk that reminds me to stop to talk about this for just a moment. So mindfulness, such a buzzword now, but for good reason. I'm really happy about it. I wanted to give another little, I think this is my last piece of data, but I like this one. It's actually not numbers, but it is about a research study. Just came out at the end of 2022. It was a study published in the Journal of the American Medical Association, or JAMA, and it shared results, a research study, which looked at the use of a common anxiety medication versus MBSR, which is mindfulness-based stress reduction, which is an anxiety-based treatment model, which is used for anxiety. It can also be used for depression. The study concluded that mindfulness practice works just as well, equally as well, as medication with fewer side effects. So there's my little soapbox plug. But it's so wonderful because there's so much research, that's so much evidence about the power of mindfulness now. So some other things in this category, which are classic concepts or activities, are spending time in nature, engaging in our hobbies, spending time with our pets, having positive self-affirmations, journaling. So these are all things that help us on the psychological sphere, the psychological domain of self. So here are some daily doables. Using a meditation app for 5 to 10 minutes a day. Closing our eyes and just taking like few, 3 to 5 to 10 deep breaths regularly. Going outside at any time and just taking a moment, right? It's just a moment to look at the sky, the suns, watch the clouds for a couple of moments, just passing, spending time petting your pet. My dog sleeps on the couch next to me here in my little home office, so I often just roll my chair over there and give her a little love. Writing down inspirational quotes and posting them in your daily view. So I am a huge proponent of this. I change mine frequently. The two that I have right now are the bigger the heart, the smaller the self. And the other one that I have, which I just put up last week, says the longest relationship in life is with the self. So simple, right? Our longest relationship in life is with the self. So sometimes that's my own little reminder about the importance of self-care. Okay, so social, moving on. Spending time with family and friends, clearly engaging in social activities, the classic concepts. So making time for that. Make a little time each day or each week to connect with loved ones. And I wrote here on phone or in person. And then a balanced use of social media. So I put down phone or in person because, there's so much, efficiency and efficacy, right? And so it's easy to communicate with people in all these digital different ways, which are wonderful. But and from my perspective, and I think a lot of people may feel this way, voice to voice, especially even face to face, it really helps that level of connection on such a deeper level, because people can end up feeling more disconnected sometimes through the use of digital platforms and social media and such, rather than just picking up the phone sometimes. And one more little last thing, soapbox about this, for me, about social media is, and digital platforms and such, is that, you know, they're great. They have a lot of value. I think they're wonderful. And they can be used as amazing tools. And we have some listed at the end. So I am a big proponent of using meditation apps. And, you know, if you have time to use or so, go on social media. You know, if you've got that time to spend a few minutes every day to go on social media, you really do probably have time to replace some of that, at least 1 or 2 sessions with your social media, with a brief session with a meditation app. So, okay, I'll get off my soapbox now. All right, spiritual, keeping or observing or developing a personal spiritual practice, whatever that looks like for you. It's very personal, spirituality. And then framing that into daily doable practices, so setting an intention for each day, right? What you want for yourself, like maybe today I'm going to be more patient, or maybe today I'm going to really focus on my words and what, you know, speaking wisely, just whatever it is for you for that day. Practicing gratitude, giving thanks before you eat, these are examples. Also, the psychological sphere, there's a little bit of overlap, but oftentimes, you know, with some of the psychological and spiritual, so, you know, some of the things that are listed there can help, you know, build on that category as well, or that domain. So some of these practices come really easily and naturally, but, you know, others take cultivating, and I think we're all guilty of telling ourselves we don't have time. And I think I just mentioned a moment ago, it doesn't have to take a lot of time, right? The idea, overall idea here, is if we redefine and we reframe what self-care is and begin to practice it daily, little by little, it becomes manageable, and, you know, feels manageable and can become a habit. That's the goal, creating some of these things into habits. Okay, so back to the doing nothing example. Knowing when we've reached the tipping point is super important. And having a self-care safety plan is a really good idea. So, so think of this as like emergency preparedness, like a fire escape map in an office building, or an earthquake kit you might have at home. So, you know, really the way this is looked at is, you know, how persistent is it? You know, length, duration, and severity. Persistence and severity, duration, and, you know, that kind of stuff. So what we're looking at here, one of the examples that I'm giving is 2 weeks. That tends to be the marker. So I'm sorry, frequency, you know, and duration and severity. So lasting 2 or more weeks, if you're having a significant change in sleeping, these are just examples, because you can go back and look at that list of depression and anxiety symptoms. So it's any of these for 2 or more weeks. But specifically things like sleeping or eating, trouble concentrating, frequent headaches, those are some really concrete examples. You might want to start, if there's anything in the that would fall in the biological domain, to start by consulting your PCP, your doctor, because you really want to rule out anything medical that might be going on, underlying. So psychological, any of the above things, again, it's for 2 weeks or more, it tends to be the time marker. Any of these, as well as increase in use of substances, or excessively worrying or being sad, irritable, being on edge, avoiding activities that enjoyed in the past, that might be a time to consider reaching out for behavioral health support. And then socially, again, 2 weeks or more, if you're withdrawing emotionally from people, avoiding contact, isolating, those might be, you know, might be a time to you know, move towards reaching out for behavioral health support. And then spiritual, you know, losing your hope or faith, questioning your belief system if you have a you know, structured, organized religious belief system, feeling lost or purposeless. So there's a lot of things you can do. Self-help books and literature, there's a lot of stuff out there. consulting your spiritual or religious advisor if you have one, contacting others in your practice community, as well as reaching out for, behavioral health support if you need it, because that can be really important, if you're having a spiritual crisis as well. So just really quickly, some additional signs or symptoms. This presentation is geared towards adults, but obviously kids and adolescents are hugely struggling. So I wanted to just throw in some couple signs or symptoms that are specific to children. So any of these would apply to kids and teens, but I wanted to throw in a couple of other ones that are specific to kids to just be aware of. So for younger kids, developmental regression, meaning if they're having toileting accidents or bedwetting when they've previously been, potty trained. If they're crying a lot or really clingy and that is out of norm for them, and it seems kind of developmentally excessive for their age. Being irritable or acting out or seeking what we call negative attention seeking behavior. So getting into bad stuff a lot, it's called negative attention seeking because when kids do bad stuff, we react negatively, and it is a way of, sometimes can be a cry for help for kids. Poor school performance or avoiding school, which could be related to an undiagnosed learning disability and or mental health condition. So support through school might be needed as well. Problems paying attention or concentrating, it's already on this list as well, but also what I would call phantom headaches or stomach aches, so those psychosomatic kind of symptoms. It's not that they're not experiencing them, they probably are experiencing them, but they can come from a psychological place and not necessarily a biological or physical place. Okay, so now I'm going to spend just a few moments going through some tools and resources that I have listed here, and hopefully we can get some of these out to you all after the presentation at some point. The first thing I have here is a self-care check-in. So this is a little thing, this was made by someone named Virginia Satir, who's really the godmother of family systems therapy, I believe. So this, as you can see, the domains here are expanded from that biopsychosocial spiritual. These are more domains, so it's even more comprehensive. But the idea is just to sort of check it out for yourself. So anything that you score yourself as having you have a 3 on, anything less than a 3, that might be something that you'd want to focus on, take a look at, something that you might want to build out for yourself to create that life balance. To build resilience and as a preventative way to help ourselves protect us from, the human condition becoming other conditions like anxiety and depression. And it's nice because this little thing, this little scale has a little place for you to jot down some things that you might, some ideas that you might have to help yourself. Okay. Depression. So this is called the PHQ-9, so Patient Health Questionnaire 9. Now, if you look at some of these, it might look very familiar because a lot of this has been integrated quite a lot into primary care. So your PCP, you might see this if you have a new PCP, sometimes they give this to you, or your annual physical, they might give this to you, or they might start with something else called the PHQ-2, which is just 2 initial screening questions to then figure out whether or not they should give you the PHQ-9. This can be honestly self-administered. So I'm all about, self-advocacy and caring for ourselves. So you can use this. It's just basic math. You can read how to do it. It has the directions on it. It's not hard. You just add up the numbers and you can kind of see it's just your own screening for yourself to see where you're at. And, if you're screening, 10 or above, that might be something that you want to talk to your doctor about, or maybe even start to think about, some behavioral health and mental health care. So I just thought I'd show this to you because this is out there. And if you can also find this on the internet all over the place. So as I said, luckily this is now a lot of time integrated into primary care. Here's another one. This is the other one that's the big one that's used in primary care is the GAD-7, generalized anxiety disorder. May or may not have seen this one. It works the same way, right? You can just add it up and then score yourself and see how you're doing. Again, if you're scoring in like 10 or above, it might be something you might want to get help with. And if it's lower, then, you know, really trying to figure out ways to help manage it with a variety of different kind of self-care practices that might be out there. And, you know, there's lots of tools available for people. So my point is people don't have to automatically run to behavioral health or mental health care, that depending on their level, they need to get further assessment, evaluation, diagnosis, and treatment if it's on the more severe side. Okay, here's just some tools that are wonderful that we offer through HealthNet. So there's MyStrength. So this is an interactive web and app-based wellness tool, and it provides inspiration and helps cultivate resilience and strengthens our skills to help support us in our mental health. And they're constantly adding new topics, which I love. My current new favorite is Improve the Moment, which gives simple ways to change your mood. And this is available to HealthNet members and non-HealthNet members. It just depends on what access code you use. So I have here the link or the web address, as well as the access code. For HealthNet members, it's HealthNet Well, and for other folks, community at large, it's HealthNet Community. And this is something that was recently added for HealthNet members. It's through ShareCare. It's called Unwinding. So this, this is based off of, it's an app and modules that are based off of a really good book by Dr. Judson Brewer. It's called Unwinding Anxiety, and I'm actually reading it right now. I haven't finished it yet. I'm about a third of the way through, so I haven't gotten to the tools part yet. But it's really quite good. It's written in very basic language, easy to understand, easy to interpret. So it's very accessible. So I recommend it. So anyway, the app is an evidence-based digital program that uses mindfulness to help reduce stress and build resilience. And you can use it throughout the day whenever you find yourself feeling stressed, to get a quick dose of calm when you need it. It has breathing exercises, meditations. It has some sleep support stuff on there, some visual relaxation, and other kinds of tools. So anyway, this is a newer tool that we have for members. And then I have some articles. You're not going to get these links specifically through the PowerPoint, but I think we have a document that we send out oftentimes afterwards, which has links to things. This is a kind of some curated resources about self-care and resilience. And I just want to do a quick call out for men. That's why I have that complete guide to self-care for men link. We really need to normalize self-care for men, because I think as women, we're accustomed to talking about it and engaging in it. But for men, it's not so common to really have those conversations or even know what they're doing is for self-care, and to build out on that. So anyway, so I just want a quick call out for them. And then some tools for kids, for your kids, and working with your kids. And to be, in all honesty, I really wish this was a thing when I was a kid. This wasn't a thing. Self-care was not a thing. So, if you're of a certain age, this stuff was not talked about. So I think if you're a parent and you have younger kids or even teens, that this is a wonderful opportunity to start to talk about how important it is in terms of life, right? Of balance. And, life is a marathon, not a sprint, and we need to learn how to support ourselves. And then I always throw this in. I think we throw it in too when we send this out. It's just, I always like to leave people with help and hotlines in case they're in need and if they're in crisis. So I have these listed as well. So that's the formal part of my presentation. So I'm gonna give it to you now on this slide.